Okay. Good morning, everyone. I hope you're all safe and sound at home. Okay, so in continuation with the National Health Program topic, which has started, today's topic we'll be doing is National Program for Control of Blindness. So whenever question is asked about national programs, any question, usually it will be asked for a 10 marker or else as a 5 marker. So if it is asked for a 10 marker, you always start with the program. What is the disease about? Okay, little introduction about the disease. What all you'll write in that? You'll write what is the magnitude, how much is the problem statement, where all is it distributed, among whom is it distributed, and what are the main causes of that particular disease. Okay, then how can we control it? This is for a 10 marker question. So any national health program for that matter, okay, communicable or non-communicable. Whereas if it's a 5 marker question and if you have time, you can mention little bit about the disease. Otherwise, you can start with the introduction of the health program per se. Okay, little bit about the program, little history of when is it started. It is very important to remember when was the program started. Okay, there are just very few programs for you people, so it will be easier for you to remember that. Okay, then you should write about the goal of the program. What is the actual goal? Okay, what are the objectives of the program and what are the strategies to attain those objectives? Like, for example, I'll tell you, what does a goal exactly mean? These three terms seem to be very similar, okay? But example for you, goal for a medical student, for you people, take for a short-term goal. I'm not telling you becoming cardiothoracic surgeons, neurosurgeons, not the long-term goal right now. At present, finishing MBBS, okay? Your goal is to finish MBBS with flying colors. For that, what will be your objectives? Your objectives will be finishing third year, final year, and successfully completing without any extension in the internship. Okay, this will be your objectives. Okay, or else your goal is to gain a gold medal or something. Your objectives will be, studying thoroughly. How will you study? Attaining good amount of marks in your each year. Okay, so strategies for that objectives will be like for each year it will be specified again. Like say for the third year, preparing your notes or else, listening to the classes or making your own notebook and all, reading thoroughly, referring books or your other classes you want to attend. So those things will be your strategies to attain your objectives. So I hope you understood what is a basic thing. What is goal? Goal is a primary aim, okay? The total thing. To attain that, what all you do is an objective. To attain those each objective, you will have strategies. What strategies or action plan you will make, okay? And now coming back to the program per se, in the answer, in the end, you should write what are the new initiatives, okay? Any new initiatives which are present. And if at all you can remember and it is mentioned in the part, you have to write about any challenges per se with the program. So coming to the blindness. Blindness is a major public health problem, both in developing as well as developed countries. So what is blindness? I'm going very brief about blindness because you have a whole subject on that. Full Khurana you will be reading. And in Khurana, you will leave this topic in the end chapter, community ophthalmology. So you cover that in community medicine. Okay. So blindness, any kind of visual acuity or of less than 3/60 or equivalent to it, it is blindness. This is the WHO definition of blindness. We have our own Desi definitions, that is NPCB, National Program for Control of Blindness. It's short formed as NPCB. So NPCB defined blindness as, there are many indicators also in this, that is inability of the person to count fingers from a distance of 6 meters or 20 feet, or the visual acuity which is less than 6 by 60. Okay, less than 6 by 60 with the best possible correction with the spectacles. Otherwise, another criteria is diminution of the field of vision to 20 degrees or less than that in the better eye. So these will be the criteria to diagnose a person to be blind. And there's something called visual impairment also. There is a very lot of difference between blindness and visual impairment. So visual impairment is a limitation of actions and functions of the visual system, a very literal layman meaning. But as WHO, according to the WHO, what is the classification? They are classified as distant visual impairment and near visual impairment. You all know the use for distant vision, Snell chart will be used, and the near vision, Jaggers chart will be used. Isn't it? I hope you all know that. So, distant Jaggers chart is for color, and the one book will be there for the near vision. You would have seen in your opthal postings. So distant vision, you have mild visual impairment, moderate, severe, and blindness. Near vision impairment, where the visual acuity is worse than n by 6 or n by 8 at a distance of 40 centimeters. So here are all the different types of blindness. I'm not in detail of the 7 types of blindness. For us, which is more important is, what is curable blindness? Curable blindness is at any stage, at certain particular stage, when earlier stages, when the damage can be reversed by proper prompt management, that is curable blindness. Example for curable blindness is, say, cataract. Then preventable blindness. Preventable blindness is at a very apt time, okay, if it is prevented by the methods of preventive and prophylactic measures, are levels of prevention, the primary prevention, if you do that time, if it can be stopped, okay, if it is not letting to progress, that is called preventable blindness. Examples may be xerophthalmia, refractive errors, trachoma, glaucoma, all those. Avoidable blindness is what we are going to use in throughout this NPCB. This is the combination of preventable and curable blindness. So the whole goal of NPCB is to reduce the prevalence of avoidable blindness. It can be either curable or preventable. So coming to the magnitude, how much is it? What all? So to estimate in the worldwide, almost 285 million people are visually impaired globally. Okay, among these 285, 39 million people, approximately 39 million people are blind. Okay, so in this 285 million people who are visually impaired, 246 million people, they have low vision. Okay, so why am I mentioning specifically about this low vision is, these are at the stage of preventable blindness. Okay, these are at the stage of preventable blindness without progressing them into the blind. So when the action is taken, prompt management is given, prophylaxis is given at this time, precisely actually this time, but if not possible, at least at this time, it can be stopped from progressing into complications. Again, the blindness is divided into many categories age-wise. So usually refractive errors, trachoma, conjunctivitis are the main common causes of visual impairment among children, even malnutrition. Okay. Whereas in adults, the cataract, glaucoma are the most common causes of visual impairment. And among this visual impairment among different age groups also, 82 people, a percentage of the blind people belong to the age group of above 50 years. That is almost 32 million people will be blind. Then, so the causes of blindness in India per se, Before India, globally, the causes of blindness, first comes cataract globally as well. Okay. If you can remember the percentages, well and good. Otherwise, it's okay. But the order should be like this. Globally, cataract comes first. Next comes glaucoma, trachoma, all those things. After that, refractive errors. Whereas in India, the scenario is different. Cataract accounts for almost 62% of blindness in India, followed by refractive errors, where there are 20% of people are going blind because of the refractive errors. Okay, undiagnosed, untreated refractive errors. So the causes of blindness was cataract and refractive errors, whereas the causes of visual impairment, 75% cases of visual impairment globally are due to refractive errors and cataract again. And if you see, among all these visual impairment and blindness, it is most commonly seen 90% of the visually impaired are belonging to the developing and developed countries. If you can see in this map, the dark orange color, it is where India is lying. Okay, the prevalence is almost 3 to 5%, which is very, very, very high. The burden is very high on India in regard to the visual impairment and blindness. So, how do you prevent it with such a huge burden with 285 million people? Okay, so this I'm not doing in detail, only the subheadings I'm giving. This is separately, you have to be reading in NCDs as well as in your Qurana. Okay, so the components, mainly initial assessment will be done to know the burden and the magnitude, then the methods of intervention, primary eye care, okay, like screening of and vitamin A prophylaxis, secondary eye care like refraction will be done, or else basic vision center training and screening will be provided there, basic treatment will be given, the foreign body removal treatment and all, and tertiary care, that is where the higher corneal transplantation, keratoplasty, vitreoretinal surgeries, phaco, all your ECE, all those things will come in your tertiary care. Then there are specific programs for trachoma control, that is your safe strategy, the surgery, then your antibiotics. The mnemonic is SAFE, the surgery, antibiotics, face washes, then environmental sanitation. School eye health services will be the screening of the children, periodic examination should be done, then vitamin A prophylaxis. Apart from that, you have just finished in the last class, occupational eye health services, okay, screening there, giving health education, providing the personal protective equipment there for protection of the eyes. Apart from this, the long-term measures will be improving on sanitation, providing safe water supply and good nutrition, because malnutrition will lead to blindness among, not blindness as such, visual impairment among children. Then proper personal hygiene so that they won't be touching eyes, and maintaining proper hygiene of the eye, complete eye care. Okay, so to attain all these things, the Indian government has started a program. Initially, it started with trachoma control, because at that point of time in 1960s and all, trachoma epidemic was going on. So later in 1976, a completely centrally sponsored program was launched by India, that is National Program for Control of Blindness. What is a centrally sponsored program? It means all the funds will be provided by the central government itself. States need not have to contribute anything. Okay, it seemed to be very small thing, but when you get funds from central government, it is easier for the states to implement the strategies and attain those objectives and the targets. Whereas what happened in 1994 and 95, they decentralized it little bit to attain the targets easily, giving a little command to the states. Okay, they used to give 60-40, like 60% of the funds and all will be given by the center, 40% of the funds should be borne by the state governments. So that is when District Blindness Control Society was started. So NPCB is a 5-marker as well as a 10-marker question. EBCS, that is District Blindness Control Society, is a 5-marker question. So what is the goal then of NPCB? The goals of NPCB is to reduce the prevalence of blindness to less than 0.3%. Okay, and this is the primary goal of NPCB, of the particular health program. Apart from it, to establish an infrastructure which has efficiency to cater the new cases of blindness every year, to cope up with the burden of the new cases which are coming, the incidents, as well as the old cases which are already present, so that the backlog is reduced. So to achieve this goal, the objectives framed by the government were: first is they want to reduce the backlog. How is the backlog reduced? By identification and treatment of all the curable blind cases, okay? All levels, at primary, secondary, and tertiary levels. Then to develop the comprehensive eye care facilities. Comprehensive eye care means not only the primary eye care, in the PHCs also providing a complicated case treatment also in the villages rather than referring them. Okay. Apart from that, strengthening and upgradation of the regional institutes of ophthalmology so that they can become the centers of excellence. Okay. These centers of excellence are already, they partner with medical colleges, district hospitals, sub-district hospitals, NGOI hospitals, so etc. Then they want the participation of the NGOs, voluntary organization, as well as the private practitioners also. Okay, to implement this public-private partnership. So they want that participation also, to securing the participation of private. Then to enhance the community awareness, the core and the heart of any national health program is community awareness activities by implementing any IEC activities and all that. So apart from this, they want to continue the main objective, the signature activities which have been the constant objective of the program, that is performance of many lakh of cataract operations every year. School eye screening should be continued. Distribution of free spectacles, okay, and collection of more than 50,000 donated eyes per year for keratoplasty. So to achieve these objectives, the strategies which were implemented were: the main emphasis was given on free cataract surgeries. Everybody have to mute your mics. Okay. So emphasis was given on the free cataract surgeries, that is not only the government hospitals, involving the NGOs and private practitioners also. Okay. Then on the comprehensive eye care programs, that is not only on concentrating on cataract itself, other things also should be concentrated, like diabetic retinopathy, glaucoma, corneal transplantation, vitreoretinal surgeries, and treatment of the childhood blindness also. All these things should also be focused so that these diseases which need immediate action can be eliminated, which helps in eliminating the avoidable blindness. Then active screening. Screening is the main aspect of National Program for Control of Blindness. They conduct camps, cataract camps, glaucoma camps, refractive error camps, and all, so that they can diagnose the disease prior and can be referred, transported for any operable cases in the timely manner. Then screening of children, which is very important, because refractive errors start from the young childhood itself. So screening of the children, identifying and treatment of the refractive errors, and even provision of the free spectacles to those affected, maybe particularly people who belong to a poor socioeconomic strata or something. Then covering the underserved areas, the tribal and hilly areas, if the government is not able to access, partnering with the private groups, okay, private hospitals, private companies, and all that, so that every nook and corner of the India, of the country, is covered. Along with this, capacity building of the health personnel, that is giving training. Okay, updating the doctors, updating the ophthalmologist, updating the technicians on the newer aspects of ophthalmology, the machines, the operations, treatment aspects, conducting conferences, CME, giving training. So, and building the capacity, increasing the number of seats, so varied aspects under this. Then coming to the IEC, many IEC activities are conducted under NPCB involving celebrities, involving many influential people. If you, I don't know if you were even born, there was a very famous there's a very famous ad by the Aishwarya Rai. I don't know if you all know that or no. So she comes and she tells that the beautiful eyes she has, and she tells that if you want to donate eyes, kindly pledge for eye donation. Okay, I think you all know about eye donation pledging and all that. So she has, it's a very famous ad. You can Google and check it out. Then regional institutes of ophthalmology should be strengthened and they should be made, state of art facilities should be provided there, improving the infrastructure, providing very upgraded state of art facilities. Regional institutes of ophthalmology in India per se, we have in New Delhi, Rajendra Prasad Eye Institute one, and there are many. Each state and each state has many. Another one is one more we have is LV Prasad Eye Institute in Hyderabad. Then you have Shankar Netralaya. So all these different aspects are, regional institutes of ophthalmology are present, which has to be upgraded, okay, to the centers of excellence. Okay, like they are the topmost excellent institutes which will provide all the policies and programs. Then again, upgrading the district hospitals as well for the infrastructure and equipment and manpower. Apart from it, the main aspect is continuing the emphasis on primary health care, okay, by establishing vision centers in the PHCs itself with the help of paramedical ophthalmic assistants, training the health workers. Not only that the doctor is not available, training the ASHA workers, village health staff, okay, to become ophthalmic assistants so that at the primary level only they can be screened for any kind of visual impairment. Then you have mobile van, the mobile units, the mobile ophthalmic units, which are upgrading off late so that they can reach all the inaccessible areas also. So I have told you about the different objectives, strategies, programs, and all that. Who gives all these commands? Okay, who tells what to do? Who gives us the guidelines, policies, SOPs, fund, and all that? So the organizational structure goes like this. It starts from the center, where in the ophthalmic section of Director General of Health Sciences or the MOHFW. Then the central will will tell the state to implement the state ophthalmic cells or Directorate of Health Services or state health societies. Okay, they will be the following the orders of the center. Then the district blindness society will be following the orders of the state. So it goes from top to bottom approach as an organization. But as a service delivery and the referral system, it will go from bottom up approach. That is the primary level sub-district hospitals, community health centers, or the small ophthalmic units where there are paramedical ophthalmic assistants which are present. Okay, they will treat the basic screening and primary level care will be given and refer to the secondary level, that is district hospitals or NGO eye hospitals. Okay, they will further revert to the tertiary level where there are medical colleges, the centers of excellence, regional institutes of ophthalmology, training institutes, etc. will be there. So coming to the District Blindness Society, this was a decentralized part of NPCB which was started in 1994 to 95. So it was a new initiative under NPCB where the main objective was to reduce the backlog of all the of avoidable blindness cases. How did they do? By planning, implementing, and controlling the activities in the district level per se. Okay, and reporting it to the state further. How the program, what all was included, same things, comprehensive eye care was involved, then school eye screening. Apart from that, community-based rehabilitation is one of the main aspects of DBCS. What is rehabilitation in NPCB is the person who is blind, okay, giving them the services, referring them to the facilities. The differently abled will be referred to the special schools so that their social, aspect won't be hindered. Okay, they can continue their life peacefully. They can continue. Vocational rehabilitation will be given, giving training in that aspect. That is community-based rehabilitation. Okay, Vision 2020, the right to sight. This is a 3-marker question as well as a 5-marker question and the core aspect of NPCB. Okay, so what is Vision 2020? This was a WHO global initiative which was started to intensify. Okay, already the programs have been happening. Okay, under the NPCB, under DBCS, under many NGOs, many awareness programs, and many things were under already happening. But Vision 2020 was started to accelerate the activities for the prevention of blindness. Okay, so to achieve the goal of completely eliminating any kind of avoidable blindness by 2020. So you must be wondering, it is already 2020. So what else is Vision 2020? So what usually happens is they keep a target and a deadline in health programs. They try to achieve it by various strategies. If at all they are not able to, okay, if for varied reasons they are not able to achieve that, so under the sustainable development goals, where the development goal target has become 2030 to 2035, okay, under that development goal, they will again increase the target. Like now the goal is 0.3% prevalence, they will reduce it to 0.2% or 0.1% in that span of time. Okay, if it is not attained by Vision 2020, maybe with further more aspects, more rigorous training and rigorous activities, it will be attained in system sustainable development goals. So what are the objectives for Vision 2020 are, they have certain target diseases here. Okay, they want to avoid and eliminate those diseases. Those target diseases are cataract, refractive errors, childhood blindness, corneal blindness, glaucoma, and diabetic retinopathy, as well as development of human resources and infrastructure. How have they done this is, they've proposed a 4-tier structure. Okay, a 4-tier service delivery pyramid was proposed where 20 centers of excellence will be present in the country, preferably for every 50 million population, one centers of excellence or something, then 200 training centers, 2,000 service centers, then 20,000 vision centers will be established in the country to achieve the final goal, that is elimination of avoidable blindness. That vision centers, at least for 50,000 population, one vision centers should be present. So what do these centers of excellence and training centers, what they do? Center of Excellence, they provide the professional leadership. Okay, they implement the policies, they give the guidelines, they lay the standards. Okay, like what treatment should be given, what surgery should be implemented, what surgery should not be there, what is a conventional method and what is upgraded one. Like you have the conventional cataract surgeries was upgraded to phaco, extra capsular surgeries, then IOL implantation, sutures, so all these things. Then research aspect will be focused in the centers of excellence, monitoring of the quality of the other institutions. Training centers will be medical colleges, training institutes. Like in Bangalore, we have Minto Eye Hospital. So varied hospitals will be there where the tertiary eye care will be taken care. That is performing retinal surgeries, corneal transplantations, glaucoma, and again training in CME, training for the service centers as well as the vision centers. So this comes for the tertiary level of prevention. The secondary level, they will establish, the proposal was to establish service centers, 2,000 service centers to implement any cataract surgeries, the common eye surgeries, the referral services, okay, whatever is referred from the vision centers at the PHC level will be taken care in the service centers. In the vision centers, they basically do the screening, provision of the spectacles, refractive errors, then primary screening will be done, then referring the people for the rehabilitation. School eye screening program is main aspect, main feature of vision centers. Apart from government, we have many international agencies also, international agencies which contribute in the development of NPCB, that is WHO. They every year they take 40 fellows, okay, intra-country fellowships will be provided for by WHO in varied kind of certificate courses and all that, and they help in survey of childhood blindness, okay, a multi-centric survey, not a survey of a village and all, a different country by survey and all that. So these intra-country fellowships, they may be for any vitreoretinal surgery, lasers in ophthalmology, pediatric ophthalmology. So all these fellowships will be provided by WHO. Apart from it, we have something called Danish International Development Agencies. These are all your voluntary health agencies, which you'll be reading in your international health chapter. So, what does Danish International Development Agency do? They provide manpower. They help in development of manpower, then management of the systems at state levels. World Bank. For everything here, whatever I have mentioned, the first thing comes to the question is who provides the funds? Okay. Yeah, center will be providing funds, but center has many other government programs, many other aspects to take care of. A little contribution in this is even given by World Bank. Okay. World Bank helps in, it is not only for India, for other countries as well. Okay. World Bank helps in, it assists for any cataract control society programs, for upgradation of any regional institutes of ophthalmology, for proper functioning of DBCS. Why do I mention DBCS particularly again and again is DBCS is the one which does the screening, one for the community-based rehabilitation and provision of free eyes spectacles, okay, in the schools, specifically in the schools, free eye spectacles will be provided. So there are varied NGOs, many number of NGOs are there. The Sight Savers is a very famous one, then International Agency for Preventable Blindness. Then you have Rotary International, Lions Club International, Orbis. So if you know all these well and good, it's better to write one or two about the NGOs, particularly for NPCB, because NPCB is one such program which has a highest amount of public-private partnership involved. Okay, it's a one very good example because where this program it has covered almost 640 districts in India. That 640 districts is with the help of not only government but even the private practitioners and NGOs take part in it. So very good example. So that's why you should mention about the NGOs. Then, apart from Vision 2020, there was one more thing which WHO implemented, seeing the huge amount of magnitude of the cases. So, a global action plan was given. Okay, this global action plan was accepted. It was given in the General Assembly in the WHO and it was accepted by all the member states, that is all the other countries, where the emphasis was given for the universal access for the eye care. Okay, it was universal health coverage, universal eye health coverage. Then implementation of national plans, whatever the strategies and objectives were proposed to implement them, this global action plan used to help out for that, and providing any research. Okay, research was done for any evidence based research to implement any kind of new programs and new strategies, and funding, part of the funding was even given by this universal eye health global action plan. So under NPCB, the new initiatives which come are Ophthalmic assistance, it was only left to the district hospitals. They never used to go below that. Okay, so this ophthalmic assistance, the new initiative was providing presence of an ophthalmic assistance even in the primary health centers. One ophthalmic assistant at least, or else training a person who's already available there in the screening of the basic eye diseases. Then eye donation counselors. Okay, this was done on a contract basis. Eye donation counselors, why do we need them? Because for the, counseling the relatives of terminally ill patients, or, progressive illness, or people who have already pledged for eye donation. Okay, so the counselors will go and they will explain the relatives, because it has to go hand in hand with the customs and beliefs of whatever the end time procedures which happen. So they counsel them and they tell them that the eyeball won't be disfigured when they do this the removal of the eye. Only the cornea will be removed. Okay, so for the corneal transplantation, right now India needs more than 50,000 corneas, okay, to prevent the corneal blindness, more than 50,000. But India is procuring approximately only 24,000 corneas per year, approximately. Okay, so we need a lot of pledged eyes, pledging of, though people pledge for eyes, they won't intimate it to the relatives. Okay, so whenever anybody pledges for eyes, it has to be intimated to somebody, some person, the guardian or anybody who is there, so that in the nth moment when the doctors do come or the concerned personnel come for the collection, there should not be any kind of problem. Then upgrading and development of a mobile ophthalmic units, improving and increasing them in more and more and more amounts, so that all inaccessible areas can be covered. The other main aspect is grant in aid for NGOs. Okay, what is this grant in aid means? Government provides certain incentives, okay, certain amount of money to the hospitals, because they have told hospitals to do free of cost. Cataract surgeries have to be done free of cost, but government gives money to the that particular hospital, varied from, it differs, okay, maybe 1,000 1,500 rupees or something per patient they will be providing. So this was only under government to government. So the new initiative was providing this grant in aid even for the NGOs. Okay, NGOs not only for the cataract surgeries, for even for any laser techniques or corneal transplantation, glaucoma management at the rate of 1,000 per case. The amount varies. So approximately it was 1,000 to 1,500. Grant in aid was even proposed for NGOs as well. And the very, very, very newer aspect, it is not very new, but a newer aspect is teleophthalmology. That is telemedicine in ophthalmology. Though we have mobile ophthalmic units and all that, they should have the specialists to take care of it. So if you can see in this picture here, what do they do is a trained person will be sitting, and through the examination, refraction will be done, and the images will be sent to the main institute, whichever the ophthalmic center, the teleopt consultation center which is present there. A consultant or the specialist will be sitting there who will give the precise treatment, whether the case has to be treated, whether the case has to be referred immediately or can be taken care at home. So those aspects can be covered in teleophthalmology. And you should even know about certain important days which are observed under any health programs. Likewise, here, World Sight Day is observed on every second Thursday of October. Every year, second Thursday of October. And National Fortnight for Eye Donation is observed. Fortnight, that is 15 days from 25th August to 8th of September. And 12th of March is observed as a World Glaucoma Day. So I think you all would have participated also. Few of you have participated in this Glaucoma Day and World Sight Day and all that. So with this, I finish the class. I hope you have understood. The questions they ask you is what is NPCB? 5 marker question will be asked. what is NTCB, then what is DBCS, very, very, very common question which asked, then Vision 2020. Yeah. So stay safe, don't go out, and make your plans and goals and objectives. Start studying thoroughly for your exams and all, whichever, whenever they are. Okay, take care.